You think you have Achilles tendonitis, but you most likely have Achilles tendinosis.
3, 2, 1.
What is Achilles tendinosis? It is when a tendon is chronically overloaded over a long period of time, and instead of all of the tendon fibers going up and down and parallel to each other, it's like taking the box of spaghetti and throwing it on the ground, so all the spaghetti is going in the wrong direction. It's starting to degenerate. 97% of Achilles ruptures occur to an Achilles that's already tendinotic or degenerated. So it's very important to get a degenerative tendon fix to the extent that you don't want to get a rupture in the future. So Jess has been a patient of ours for a while, and she started doing lots and lots of kickboxing a few years ago, and this Achilles tendon issue has come up, I think maybe a year ago, and she's about 80-85% better, which is actually amazing results because I don't see her as often as I'd like to see her in order to fully resolve this condition. But Achilles tendinosis can take a very long time to fix if it's allowed to fester and get worse, and I've seen Achilles tendinosis issues that are 2 to 3x as big and thick as a normal and healthy Achilles tendon.
And after boxing, how's the Achilles?
It's been improving in terms of like it doesn't hurt as much afterwards. Like sometimes it doesn't hurt at all.
Achy, 1 out of 10?
Yeah, it can be achy probably the 1 out of 10. But I am noticing that because I know the numbers sound the same, but it's feeling different.
Got
in terms of
feels like it's improving.
Yes.
So when she says something like it feels different, that matters to me because she understands she's had a lot of treatment from other people who aren't us, and she's had a lot of treatment from us. And she's able to feel things because of the volume of treatment that she's had that allow her to be more tapped into her body and to give us more helpful data.
Just missing it.
Yeah, it's just missing it, but it's as far as it's wanting to go. It's mostly just like a restriction from the front.
Is there anything you could do right now to make the Achilles, to make it worse or provoke it a little bit?
It would just have to be repetitive, like straining of it. Like there's not a single motion typically that like immediately will provoke it.
So
like
doing this a few times?
Yeah, so like this motion where I'm like leaning back on it, I can start to feel like a strain on the inside of it.
0 to 10.
Just like probably like a 2. And if I was to continue with that motion repetitively, then it would probably go back up to like a 4.
So that strain is most likely the tibialis posterior tendon, whose responsibility is to maintain the arch. And because she's pointing right at that position, and we also know that she usually has tibialis posterior adhesion, tibial nerve at tibialis posterior entrapment, that's why she continues to feel that spot that's medial or inside the Achilles tendon. So it's just important we understand and know what tissues are pissed off and why, because that gives us a hint as far as what we need to do to restore their function so that ultimately the Achilles tendon can stop working overtime. Plantar flexion and inversion, please. Got it. Go. When somebody has chronic leg, ankle, or foot symptoms over the course of their care, it's going to be important that all areas of the leg, ankle, and foot get checked. This is superficial peroneal nerve, peroneus longus, because these nerves come around to the top of the foot. And she's a little bit stuck up here. I'm checking her shin and their dorsal foot today, especially the superficial and deep peroneal nerves, because I haven't done this anytime recently, and if those nerves are entrapped, it will cause the shin muscles to stop working and cause the calf muscles or the gastroc and soleus in the Achilles tendon to work overtime. Plantar flexion and eversion. This is a deep peroneal nerve. Go ahead, James. I'm going to treat your Achilles with the pressure waves. This is really good for tendons, and that's what we're going to do. Can you stand on your right toes? You okay?
Okay? Yeah.
I'm having her contract the gastroc soleus and Achilles tendon. So this is a way to increase the tension of the tissue, and so it's loading it. And I'm also using the broad head of the radial shockwave to get all areas that I can access for the tendon. So I'm getting the back side right now, I'm getting the right side of it, or the lateral side, and then I'm gonna get the medial side. I'm also gonna try to get anterior to it, because when a Achilles tendon is tendonotic, it becomes thickened, and you want to use the radial shockwave to produce new blood vessel growth in order to start to put the collagen fibers back in line with each other, so they're all going up and down instead of haphazardly in the wrong directions. So radial shockwave is a really good treatment directly for the tendons after all of the nerve entrapments and the adhesions have been released, so that load on the damaged tissue has been lowered. Otherwise, if I'm just going to radial shockwave the Achilles tendon without doing that first, I might as well just give her a cortisone shot and have her walk on her way. Everybody knows that treating the effect doesn't work. You have to treat the root cause.